tiring and it's emotionally exhausting.
So that's what some people would call burnout, right? But
Yes.
we prefer
Moral injury.
Central Texas nurses say they are tired and stressed to the brink, caring for patients at overwhelmed hospitals.
As of Monday, the Texas Department of State Health Services reported the fewest number of hospital beds available for Central Texas patients since January 31st, including 0 beds for pediatric patients.
And I sat down with nurses who say they and our hospitals can't keep up with this level of stress. As the sun beams down on this small pond tucked away off of Lamar Boulevard, a sense of calm can be felt in almost every space of the park.
We'll see what happens with that.
But for nurses Kellen Gildersleeve and Taylor Crittenden,
I know that transparency is key.
the conversation is heavy. The topic, their mental health, working conditions, and the implications on our healthcare system here in Central Texas.
When you go home knowing that you could have done more for a patient, but you were not given the resources to do that, it wears down on you.
Do you think because of the lack of resources that you all receive that will have a detrimental impact on our health system that's already fragile?
I would argue that it is already having a detrimental impact, yes. We are, for instance, seeing elective procedures pushed back or canceled. Even medically necessary surgeries delayed for days or sometimes weeks.
They also believe there will be an increase in admissions and readmissions. This was the start of an almost hour-long conversation on their current struggles, some of those highlighted in a 2022 survey from Trusted Health. It shows 75% of nurses surveyed reported feelings of burnout, 66% compassion fatigue, and 64% depression.
It's very precarious for people who, this is their lives, this is their health and safety, and it just doesn't feel like we have prioritized that.
The two say with the population growing exponentially here in Central Texas, they are concerned about our medical system being able to provide for the people who live here.
And that's going to end up putting a crunch on nurses that is not appropriate for people that are supposed to be thinking quick on their feet in potentially dangerous situations.
And they're both open about mental health, saying their struggles stem from several factors, including understaffing, which they say started before the pandemic, and simply not being heard.
I've been in therapy for a while, even prior to the pandemic, but during the pandemic, it hit harder.
Nursing has given me so much. So I don't want to say that nursing, being a nurse, is the cause of my mental health struggles. Rather, I want to say that being a nurse who is struggling to care for their patients under this current system can drain you.
So what's their solution? They want safe staffing ratios and legislation to address workplace violence. But they say it starts with conversations like these with other nurses and also standing together, which they are doing as members of National Nurses United. Late November, they rallied as nurses prepared to begin negotiations for the first contract with hospital management at Ascension Seton.
I do believe that with the power of the union, we have opened so many doors.
Was there ever a point where you all felt like, I don't know if I'm called to do this anymore? I might need to get out of the profession.
Yes, all the time.
Yes, yes. Everybody, what I like to say is everybody is sick and tired of being sick and tired. But it has become very obvious that we are going to continue to be sick and tired until nurses actually stand up for themselves.
I don't want them to have to experience what I experienced.
Exactly.
And that pain. It was very, very painful trying to say, am I just not cut out for this?
Yes.
Am I just not meant to be a nurse? When in my heart, I know that I'm good at this job.